So numerous randomized trials have demonstrated that lowering LDL and lowering systolic blood pressure each reduce the risk of cardiovascular events. In addition, Mendelian randomization studies suggest that the benefit of lower LDL and lower systolic blood pressure may increase over time. Together, those studies strongly suggest that prolonged exposure to the combination of both lower LDL and lower systolic blood pressure may substantially reduce the lifetime risk of cardiovascular disease. However, the effect of lifelong exposure to the combination of both lower LDL and lower systolic blood pressure has never been evaluated. In fact, ideally, we would like to evaluate the effect of long-term exposure to both lower LDL and lower cardiovascular disease in a long-term trial, but that trial will take several decades to complete, and so for that reason, it's unlikely to occur. In an attempt to fill that evidence gap, we used genetic variants associated with lower LDL and lower systolic blood pressure as instruments of randomization to randomly divide the population into groups with lifelong exposure to lower LDL, lower blood pressure, or both. And what we found is that the combination of exposure to both lower LDL and lower systolic blood pressure have independent, additive, and dose-dependent effects on the lifetime risk of cardiovascular disease. In fact, any combination of increasingly lower LDL and lower systolic blood pressure was associated with a dose-dependent, log-linear association with lower risk of cardiovascular disease that was proportional to the absolute exposure to the combination of both lower LDL and lower systolic blood pressure. We think these data really strongly suggest that, or confirm, that most cardiovascular events are preventable, and it suggests that we can prevent most cardiovascular events with prolonged exposure to the combinations of both lower LDL and lower systolic blood pressure. In addition, because the benefits appear to increase over time, these data strongly suggest that even small reductions in LDL and systolic blood pressure can potentially result in dramatic reductions in the lifetime risk of cardiovascular disease if those exposures are maintained over time. So that, for example, just 0.3 millimoles lower LDL and 5 millimeters of mercury lower systolic blood pressure was associated with a 50% lower lifetime risk of cardiovascular disease. These are the kinds of decreases that can be achieved with commonly prescribed diets like the DASH diet. And therefore, the results of this study strongly support the new 2019 ESC EAS lipid guidelines, which strongly recommend a lifetime approach to cardiovascular disease prevention and specifically recommend therapeutic lifestyle interventions to achieve lower LDL goals at all levels of LDL risk. And then finally, these data can be used to inform new lifetime risk prediction algorithms and inform the development of the next generation of cardiovascular medicine prevention guidelines.